Satish Movva was working in tech and taking care of his aging parents when he had an idea. What if a wearable designed specifically for seniors could track motion and behavior to such a degree that you could predict health problems before they happened? With the company CarePredict, Movva has realized this dream, and now that wearable is being used for incredibly accurate contact tracing. Satish has been busy, but we caught up with him in between tech installs to learn a bit more about how CarePredict is giving seniors more freedom and their families a bit of peace of mind. I'm Logan Plaster, Editor-in-Chief at Startup Health, and this is a Health Innovation Update.
But I was merely trying to solve a personal problem, taking care of my own parents. I'm the primary caregiver for my dad, who's 94 this year, and my mom, who's 84. They live 10 minutes away from me. And I speak to them every day, but when I showed up in person to meet with them on a Saturday, I would find completely new and different things that I had no awareness of. More often than not, those caused me to either take them to the ER that very day, or pretty much mess up my my entire next week's schedule to get them specialist appointments and just tend to their healthcare needs. And it kind of got to the point where it became very hard for me to juggle what was going on in their with their health and the unpredictability of it. And that was just causing havoc in my life. I was constantly having to cancel work travel or family events or whatever to take care of my parents and these unexpected issues. I really wanted to see if there's something that would give me a little bit of a heads up on what's going on in their life, so I would have some certainty in mind.
And what was the
That's
year? What was the year to give me a framework of where technology was at the time?
Yeah, this was back in 2013, and when I looked around, what I found was majority of the solutions out there for monitoring seniors at home were really repurposed burglar alarm components of the last 40 years. So they would take those motion sensors and put them in rooms to detect occupancy of room. They would take those old door and window switches and they'd put them on everyday objects like toilet flush handles or refrigerator doors or medicine drawers, you name it. And to try and ascertain how an individual is doing by just trying to see which things got activated. And for a whole host of reasons, those didn't work for me at all. I mean, I had two people in the home, so the motion sensor was useless in telling me who was where. And the door and window switches were relatively useless because they asked you to make too big of a leap of faith. So, just because the refrigerator door opened and closed, you have to assume that they ate.
Right.
Or if the toilet flush handle went up and down 20 times today versus the normal of 10 times, is it because my dad or mom has a GI issue or a UTI issue? Or is it because they had, the grandkids were over or the friends were over or the cleaning crew was over and they caused the thing to go up and down? You couldn't ascertain anything without a whole lot more information and calling them and figuring out what actually happened. And so for all those reasons, it's useless.
I find it really interesting. So you're comparing what you wanted to develop to a relatively sophisticated option when there's a lot of seniors that have none of those. So you wanted to create something better than what I would consider a decent standard. And yet you've got this whole other problem, which is people who have none of it, right?
Exactly. And it's a very widespread problem in general in aging, because aging takes the full spectrum of economic means as well. There are folks that have nothing but perhaps a life alert button that they can push to call for help once something happened. And there are some that have these proactive systems, but really based on obsolete technology. And then now you have room for a very sophisticated solution like CarePredict. But we really wanted to kind of address the full continuum of all of them and try to find a solution that works for a senior, no matter where they live, whether they're living at home with a family caregiver providing occasional assistance, or whether they're living at home with a professional paid caregiver providing assistance, or whether they're living in a senior living facility, with 24/7, assistance from caregivers. We wanted something that addresses the need of that individual across all three settings. And that's how we kind of came upon with CarePredict and how it should work. It needed to work in all these settings with all these different stakeholders, if you will. So we needed a product that that was on body, so we could track each individual, not put something in a room and try and figure out who might be in that room, which is impossible. And then we wanted to track where they are in the house to extremely tight precision. Are they in the bedroom, the bathroom, the kitchen? And that was really important for the underlying reason for CarePredict, which is trying to track activity and behavior patterns, because they tend to be precursors to declines in health. I mean, that's the underlying premise of the company. But to get to understand the person holistically, are they, what kind of a life are they living? What is the quality of life? How active are they? Are they bathing? Are they eating? Are they grooming? What kind of sleep are they having? Are they being active or not? And for you to get that level of information, you really need to know precise location tracking and things like that. So those were intrinsic functions of the product.
What are some of the trends? What are some of the trends you're able to track through CarePredict that you're the most proud of? Kind of that pulls from interesting granular data that you might not think would be possible to tap into.
Yeah, so that's a very insightful question, because lots of senior remote monitoring is focused just on physiological measurements like heart rate or blood pressure and stuff. And those are wonderful if you're treating somebody for a clinical reason and you're looking and seeing how they are doing. And it's essentially you're maintaining what they are, their disease state or whatever it may be. But you really need to track activities and behaviors to be able to predict something that hasn't happened yet, right? So what we are really proud of is when we started tracking all of these correlates, we started seeing that we can now detect the probability of somebody falling a week from. We can give you the probability of somebody having a urinary tract infection 3 to 4 days from now. Or depression 7 to 10 days from now. And it's super interesting that the correlates for all of those are strictly around activity and behavior patterns. It has nothing to do with physiological measurements. So for example, somebody that is on track to get a urinary tract infection, could, they start showing different bathroom activity patterns, duration and activity in the bathroom. How often do they go to the bathroom? How long do they stay in the bathroom? So those are things that you cannot track with any other kind of a wearable or any other kind of a system today. You could do that with motion sensors if there's only one person living in the home and you can see that individual going to the bathroom X number of times. But the minute somebody else either visits the home or use the bathroom or whatever, that you throw all that data out because it's useless. In our case, because we're tracking each individual, it became super easy for us to do that. Another one is depression. People heading into depression, they start showing signs and symptoms of self-neglect. They stop caring about how they appear. They stop bathing. They stop brushing hair, teeth. They have restless sleep. They stay away from bright lights and sunlight.
And you're able to measure a lot of that through a wrist wearable. Some of those, yeah. How can you measure? Yeah, like what aspects of self-care can you measure just from the motion of a wrist?
So from the motion of the wrist, we track things like eating, the fork being lifted to the mouth, things like that.
Okay.
But we can also look over a pattern of time and see brushing hair, things like that, grooming activities. But we can also, because of location tracking and additional sensors that are already on our wearable, we can detect events like bathing, cooking, all of those. So we take all of those holistically. All of these are different correlators, and then and the deep learning network surface, a particular, how do I want to say this, a particular set or pattern of correlators that are tied to a labeled event, such as a fall or a depression or a UTI. So that's how you train it across the board.
Got it. Very interesting. Take me to beginning of 2020 and kind of where the company and the product stood pre-COVID-19. and then I want to hear kind of how the pandemic affected the business and caused you to kind of rethink how you did daily operations, but how CarePredict was going to stay not just relevant, but was going to evolve in a post-COVID world.
Yeah, so for us, 2020 was going to be our breakthrough year under a lot of metrics, even under the old paradigm pre-COVID. This was the year where we had mass production coming in from Southeast Asia, large volumes. We had placed massive orders, and we had a lot of large players ready to sign contracts, and we are planning to move into Medicare Advantage as well as into some of the larger Medicare Advantage players, as well as partnering with pharmacy companies and others. So it was really set up to be a great year for us. And the first hints of trouble started very early when Southeast Asia got hit with COVID, and all of our manufacturing products got delayed till about mid of this year. So, but while that was going on, US started going through the COVID issues, and the very first problems we started experiencing was, for example, in New York, as COVID started over there and they started locking the state down, we found that we couldn't go in and install our products in those facilities, in assisted living, independent living, because that's where all the vulnerable seniors are. And one facet of COVID-19 is that the vast majority of deaths, whether in Europe or in Americas, have been in nursing homes, assisted living, and independent living facilities. And so that's where our most vulnerable population lives. So naturally, those all got locked down. And so they were not allowing non-medically necessary folks in to go install and do things in there. And so that was the very first operational hit we took for the company, other than the manufacturing side being slowed down somewhat. And so as we started seeing the effects of COVID-19 in congregate living settings, whether it's cruise ships or nursing homes or independent living, assisted living, where a bunch of people are living in close quarters, what we found very quickly was the traditional contact tracing methods were not working. So traditional contact tracing generally is manual. You look at Korea, Germany, everywhere, it's manual. Somebody tests positive, you interview that individual, who all did you meet with over the last 4 days, and then you contact each one of those 4 people, who did they meet? And so it's a very fast spreading exponential network of people you got to kind of trace through. Yeah. And what we found was, while some of the existing technologies are great for incidental contact by public that's wearing smartphones, in a congregate living settings, that's not working at all. Because let's say you're talking about an 80-year-old person in assisted living or memory care. If you go ask them, who all did you meet over the last 4 days, you're not going to get reliable information. Yeah. So contact tracing essentially became a nightmare in these congregate living settings. Even the staff members, who tend to be the ones that are mostly the vectors for this, or into these facilities, because they tend to work multiple facilities, they tend to see a lot of seniors and so on. It becomes very hard to say, okay, out of the if it's a 100-bed facility, they've probably seen the residents, 40 to 50% of the residents. Which ones did you see? Where did you see them? How much dwell time did you have, presence with them, minute by minute over the last 5 days? Nobody. Yeah. It's not humanly possible to get there. And the staff are not wearing their smartphones while they're in the facility, because they're not allowed to use personal smartphones. The seniors don't have smartphones, so it's not like you could use Bluetooth technology or any of these things that Apple and Google tried to do. They don't work in these settings. And on top of that, every one of these solutions was based on Bluetooth. Bluetooth is a radio frequency, so it permeates barriers such as doors and walls. So 2 people living in adjacent suites, those systems will identify as being in contact because they don't take that wall in between them into account.
Interesting.
So
you were identifying all of these barriers and challenges in senior contact tracing.
Exactly, in congregate living settings. And what we've seen is that these same problems apply to whether it's a hotel or whether it's a cruise ship. It's the exact same problem. and any congregate living setting. So when this happened, we said, wait a second, this is something that's intrinsic to what we do. We have precise indoor location tracking, um, that's not based on radio frequency. It's based on line of sight, light beams. And this is a perfected technology. We have patents on it, and we've been using it for 4 years, and it's ultra precise. And half of our predictive analytics are based on location tracking. So we had all of this data. So it only took us about a week's worth of programming time to go into our product and create a new product feature set called CarePredict Pinpoint. That's our contact tracing solution that's taking all of our existing location data and just creating reports and network diagrams and maps of saying, okay, this is the person. Let's say if you pick one person in the facility that's infected, it can tell you within 2 seconds, these are all the people they've met. This is how much time they've met with them. This is the date they met them, and this is the location they met them. And even on the floor plan, you can see a path that they took through the building, so you know which areas to go disinfect. You know, which other staff members did they meet with? Which visitors did they meet with? Which residents did they meet with? Which residents did they spend more than 5 or 6 minutes or 10 minutes, whatever the threshold is, providing, services, of activities of daily assistance that are more intimate in nature, like toileting, bathing, grooming. So you could very quickly figure out who are all your high risk, most likely to be infected people, and you could quarantine them immediately without having to rely on self-reporting and manual contact tracing.
Have you started to correlate length of time between individuals with infection?
We have not correlated that, but we have all of that data, and that data was actually used by our customers. And there's been a bunch of interviews on local TV stations, especially in Texas, of our customers, not of us, about how they use CarePredict Pinpoint to very quickly figure out, where a particular infected individual was and all of those. So they are utilizing that data themselves. We have CarePredict Pinpoint 2.0 in development right now that does some of the more sophisticated work on top of it with the dwell times and actually seeing what would the propagation and spread would be. And so we actually, because we are in such a unique situation, Logan, we actually took that data and we published a paper. So it's actually in peer review now, and it's expected to be approved for publication next week, which actually for the first time in the world ever modeled how COVID-19 will spread in a congregate living settings and what are the steps you could take to curtail that. And we actually modeled all the simulations based on the data that we have in congregate living settings. So real incredible, fresh research that hasn't been done. JMIR is the publication, Journal of Medical Internet Research, very acclaimed publication. They actually have a special on COVID-19 modeling and simulation that they're launching this month that our paper is going to be part of. And we submitted it for that specific reason to them.
It's such important research. I keep hearing, my thoughts keep going to another congregate setting, schools, and how I keep hearing this cry for data and for something we can really lean on. Like, parents saying, how does it spread in schools? Like, what are the real risks? And that just happens to be that I'm a parent with small children. If I were taking care of elderly parents, that would be more my concern. But in both settings, the need to know, okay, how does this really work?
Exactly. And in fact, we did get several inbound inquiries from and school systems to see if we could deploy our product in those settings.
Yeah. In the public school system where we're at, they're looking at the, they're giving every student a laptop because so few of them have the ability to do online learning. And so you think about the expense associated with that. It would be a different way of thinking to say, no, let's invest in being able to stay healthy together with this kind of technology. Has that happened with any schools? Has anyone pulled the trigger?
No, only because and this is really us. We are a smaller resource constrained company. We have to be super focused on where we are today.
Yeah.
And that is senior group living, home care, and this is a senior segment. And there's an immediate need for that. And even if I just look at the potential orders of manufacturing orders and everything I can get done this year, we really need it for the most vulnerable seniors. They are the first priority right now.
Okay. And there's just more than enough people in need right
exactly.
now. How has the response been? You said there's been some stories in Texas about some of your partners. What was the response overall to Pinpoint? Do they understand the need for something? It's pretty forward-looking. Not everyone gets contact tracing. What was the response from buyers?
First of all, our existing customers were just completely blown out of the water. They were just so thrilled that they had this tool, and it's part and parcel of what they already own. I mean, there was teary eyes from our customers. I'm not kidding you. That we were able to deliver something like this that was such a big game changer for them. It's had some knock-on effects for them where people are suddenly seeking them out to put their seniors in because they know they have this kind of tool sets. So that's been very positive for them. And then the new customers that are coming in, that's what they're leading with. That's what they're leading with. Yes, we'd like to know how a senior is doing, whether they're going to fall, depressed, UTI, but can we get contact tracing as first part rolled out immediately? And we are getting, if you've seen the press releases, we had a press release last week of 4 new contracts. This week we have a press release of 3 new contracts. We have another 4 new that are going to be ready to go next week. So literally within a 3-week period, you're talking 11 contracts, brand new.
Which is why you're doing the interview in your car.
Exactly. But it also comes with its challenges. So with the lockdowns and things like that, we have to be careful about how we go implement and install these. We have to have full PPE and all that. And even internally in the company, we made the decision, Greg Zobel and I, our COO, look, we are going to make sure that we are the guys on the front line. We'll be the guys that'll go install. He's the COO, I'm the CEO. We'll go do the install because you need to show that you, by example, that you are willing to do what you're asking someone else to do as well in the company. So we were in Houston a couple of weeks ago. We installed I think 16 floors out of a 24-floor building. We'll be going back to do another 8 floors. Greg was in Arizona the week prior to that was installing a large facility. We'll be in California, Northern California, installing another large facility. We're also kind of prioritizing facilities that have few to no residents because they're brand new construction, so that we can get in there and out quickly, and we can refine what our processes are. And then, we're starting to go into now more of the occupied facilities that are allowing us to come in with the proper surveys, tests, temperature checks and all that going on so that we can go in. And as part of this also, what we are finding is that because we have such a rich solution in pinpoint contact tracing and everything else, we actually created a new feature set for visitor management in our product as well. So these facilities can just have a kiosk right at the front desk where somebody signs in, they go through the COVID questionnaire, and then they're assigned a badge that they can wear around their neck while they're in the facility. And that badge has our wearable device embedded in it. So we're tracking visitors as well, and where they're going in the facility and who they're seeing and the dwell times in, with every individual and room and so on.
That's
and
smart.
That is, people are finding that to be really completing that whole solution. And this has also caused a segment of the industry that we had not done a lot with, which was skilled nursing facilities. Very large operators in skilled nursing facilities are now approaching us and seeing, can we just deploy, the contact tracing and visitor management for our facility? And so that's really good for us. And we've actually kind of segmented the product a little bit as well, so we could lower the cost barriers for skilled nursing facilities if all they want is contact tracing and none of the other predictive aspects of it.
A lot's been written about how 2020 has been a catalyst for health innovation and digital health solutions, people jumping onto telemedicine, et cetera. Give me your assessment of the senior care market and where it stands now and where do you see it going in the fall in terms of, did it embrace this moment as a catalyst? Is this a leap forward? Or are we still dealing with an industry, generally it's still dealing with a market that's a bit entrenched in the past?
I would say that congregate senior living facilities were always open to innovation. I think many of the barriers were around the healthcare payer system, which did not approve of telehealth, which did not, you go into these assisted living facilities and there's a bus going out 5 days a week, carting these seniors to go in their offices. And that was really because it wasn't because it's really because the payer system was not reimbursing physicians if they saw them by telehealth and things like that. That's really changed. And I think the irrevocable change has happened on the payer side and the physician side, that telehealth is okay. You can still do your job, you can still get paid, and it's just the same quality. That's really the thing that has changed, and I don't see that going back. And senior living facilities love that because now they can actually keep the senior safe in the facility and yet still provide them the clinical, access to the clinical care that they were doing previously by having to physically transport them. Now they can virtually transport the physician into the facility to see the individual. And I think that's irreversible. I think that's pretty big, and it's we see that really growing by leaps and bounds. We have new, we have new models of care coming in where their physicians are coming into senior living facilities so they can see, 20, 30, 40 people in a day in one facility rather than have 20, 30, 40 people go to, 12 different doctors by bus, 5 times a week. So that's irreversible. That's all happening. And a lot of these larger senior living operators are also looking and saying, should we provide more suites within our building for a resident home health agency to stay on site or a physician's assistant to stay on site? And it's kind of dovetailing all into how Medicare Advantage is also approaching all this, where if you had a building that had 100 residents and all of them changed their PCP to the physician who's on the bottom floor and has a suite there, then you are really talking about a game changer in how aging seniors are taken care of with much more immediate direct access to care. And some of the newer buildings we are seeing being built, they all have either a home health, home care, or physician or pharmacies right on the ground floor of the building as part of their paradigm from day one of them thinking about designing a new building.
I mean, it just makes so much sense when you lay it out like that.
Yep.
It's you say it's a game changer, but it just makes perfect sense.
Yeah.
Last question, and I'll let you get on with your next implementation because I know you're busy. You have rolled out CarePredict at home. My understanding is that is direct to consumer because it's purchasable on your website. So where you do these implementations at facilities, sell it in B2B. Tell me about what it's like to use this as an individual.
Yeah, so CarePredict at Home is a full retail kit that anybody can go to our website and purchase it. And there's usually coupons on there as well. And it's a fully app-guided, self-install type product. It's very super easy. I mean, we have lots of people buying it during the times of COVID, just going to the website and buying it, and family members installing it for their loved one. It's really easy to use, and it provides more. It's not meant to provide more clinical type stuff. It's designed to provide more cues for the family that indicate how the quality of the life is for their loved senior.
Okay.
So it's showing them, how active are they, what's their activity levels, what's their activity score, and what is, are there, threshold violations, if you will. Are they going more often to the bathroom than normal, or are they eating less than normal, or are they sleeping with greater restlessness, things like that. But really nuanced verbiage meant for families and not for professional caregivers, and that's been really doing well. We haven't really advertised it. We haven't done any kind of marketing push on it, but yet it's selling all by itself completely, autonomously, if you will, on its own. We hadn't really pushed on that because we were more focused on making sure we take care of, B2B senior living, because they're the most vulnerable in COVID-19 right now with congregate living. So we were kind of focusing on that, but these sales are going on by themselves pretty nicely on the side. The home care side has been really bright spot for us. We also launched that in Q4 of 2019, where large franchised home care systems are buying our product and reselling it to their clients, and they're providing value-added service on top. So if, for example, if our device finds that it's 3:30 in the afternoon and mom hasn't eaten yet today, it's a home care agency that's reaching out to these individuals and to the senior, and they're saying, how come you didn't eat, Mrs. Jones? And they're going to find out, is it no groceries and my son is working or whatever it may be? They'll go do the grocery run for them. Or if it's if she says, I'm hungry, I don't feel like eating. I mean, I feel like eating, but I'm too sick. They'll actually go do a meal prep right then and there. So they have started offering on-demand services now to seniors at home based on these interventions and triggers that are being created by our device autonomously. So it's lessening the burden on the family to react no matter where they are. So they might be at work, they might be wherever. When they get these alerts, they have the peace of mind that the home care agency is going to react to that alert and is going to go and provide that service to mom. They don't need to worry about it right now.
Got it. I said that was my last question, but I lied. What would you say to somebody who says to CarePredict at home as a consumer device, I'll just buy an Apple Watch and hope that pretty soon apps kind of surface that basically put together all these ideas together for me?
Yeah, I give a lot of kudos to Apple for really making wearables seem like the norm, and that there's nothing wrong with having a wearable on you. But their market is very different, Logan. They have things like heart rate and pulse oximetry just like us, but they're really focused on a different demographic. Those Apple Watch apps or their smartphone apps are really not meant for a senior. First of all, the costs are extremely high. It's $700-800 phone plus a monthly plan plus a $400 watch. And on top of all of that, it's not on the dominant arm, so it can't tell if you're eating. It doesn't know which room you're in, so it can't tell the activities you're engaged in. It really doesn't have anywhere near the sensors you need to track really the quality of life of a senior at home or in a congregate living setting. It's, the Apple Watch is wonderful if you're a younger person and you want to quantify your own life, and your brain is providing the contextual information for you to interpret what you're seeing on the watch face or the app. But it's not really meant for a third party, to look at. I mean, if you were to put an Apple Watch on an older person and you didn't know anything about what that individual was doing and you were just looking at their data, it wouldn't make any sense to you because you don't have the context. Why is that heart rate suddenly higher? Is it because they're walking up the stairs, or is it did they fall, or did something else happen? You really don't know anything about what is happening with that individual without asking a lot of questions or being there and really bringing human observation into the mix again. With us, because we are catching such unique data points that no other wearable on the planet is doing today, we are building that contextual information ourselves. We know what is happening to a degree that nobody's seen before in senior living. We really know how people are aging at home. It's been a black box forever, but now we have deep insights about how people are aging, and we're doing it in a very privacy sensitive manner. There are no video cameras, there's none of that stuff. It's a very discreet device and it's privacy sensitive. You control, as the person wearing the device, what data points are transmitted and who gets to see them and who don't, and what kind of alerts go out and what don't. And it's very easy to use. It's there's no tiny little screen or crown to play with, or apps to worry about, or smartphones to deal with. It's a very easy to use device. It's a big button to push to call for help, and your loved one can speak to you directly through the device. And then pretty much the rest of the time, it's doing what it needs to do. And it has a replaceable chargeable battery, so you never have to take it off to charge it. You look at the Apple Watch. You're lucky if you get a day out of it. And then you're going to put on a charger. So what happens with a senior who puts it on a charger at night before they go to sleep, and then they wake up in the middle of the night and then they go to the bathroom? That's not counted. And God forbid they fall, they have no way of calling and nothing to detect them. So it's not designed for seniors.
That's
right. Not.
That's right.
And you'd be trying to shoehorn a solution that wasn't meant to use this.
Okay. Actual last question, lightning round. What's one thing that you learned from 2020, from going through the chaos, challenge, whatever you want to call what happened in February, March, April with the business and with supply chains? What did you learn through this process?
I think more than anything, I've learned that people rise to the occasion. I see that in my own company with the staff, the employees, how much they're going above and beyond everything that they needed to have done, to really react. I mean, we're a mission-based company. Every one of our employees are here because they have a senior in their life that provoked them into thinking about senior care, and that's why they are there with us. So I see that, but I also see that in the selflessness of these caregivers in assisted living, independent living, without any care for their own safety, they're in there taking care of these seniors. That's, you see that, it just reaffirms your faith in humanity. And you look at other people like, even your manufacturing partners and all of them, they know the mission and the focus of our company. They feel the urgency for why this is such an important, company to be supporting and doing all they can to get us everything we need so we can take care of these people. I mean, it's just been amazing how people have rallied around CarePredict and our mission, not only from internal, but from external as well.
Satish, thank you for your time. Keep up the great work. Hope you stay healthy, stay strong.